Welcome. You've joined us for another deep dive, and today we're tackling a topic that, well, I know many of you with furry family members might have wondered about. Non-inflammatory alopecia in dogs.
Mm-hmm.
We've gathered quite a bit of information to really dig into what happens when dogs lose hair without that obvious inflammation. We want to go beyond just, seeing the hair loss.
Exactly. It's not just, oh, the fur's gone. It's a sign something's up with the hair follicle cycle itself. And a big part of this is telling it apart from hair loss linked to hormones, the more common endocrine stuff.
Right.
And, it's interesting how our understanding has shifted. This condition, or group of conditions, often called alopecia X now, it's had so many names over the years.
Like what?
Oh, things like growth hormone responsive alopecia, castration responsive alopecia. It really shows we've been trying to figure out the why for a long time. It's still a bit of a puzzle.
Okay, so our mission today is to get a clearer picture of this non-inflammatory hair loss, see how it's different, and, well, understand what we actually do know about it.
Let's dive in.
Okay, so let's start right there. Non-inflammatory alopecia. What's the basic definition? What really sets it apart?
Well, fundamentally, it's hair loss that's considered uncommon, and it's tied to the hair follicles not cycling properly. But the key thing, the name kind of gives it away, is that inflammation isn't the main driver.
Not the primary cause.
Right. So one of the first things a vet needs to do is make sure it's not one of those more common endocrine issues causing hair loss, like, say, hypothyroidism or Cushing's disease. Those need to be ruled out.
Gotcha. So it's subtle, not just hormone-driven. Which brings us to the hair cycle itself. Can you give us a quick rundown? How does it normally work, and where might things go wrong here?
Sure. The hair cycle is, well, it's pretty complex, actually. It's regulated by lots of different factors. Hormones, yes, but also other non-hormonal signals, like right there in the skin.
Okay.
We know, for example, that increased sex hormones can definitely play a role. Estrogen, for instance, tends to inhibit the anagen phase.
Anagen. That's the growth phase.
That's the active growth phase, exactly. So if you have too much estrogen floating around, it could potentially put the brakes on new hair coming in.
Makes sense. But, okay, specifically for alopecia X, the one with all the names, what do we understand about what's actually malfunctioning in the cycle?
And here's where it gets, well, really interesting and honestly a bit baffling for everyone involved. The exact way alopecia X messes with the hair cycle, we still don't know.
Really? Still unknown?
Still fundamentally unknown. We see the effect the hair stops cycling, but not the precise trigger. Research is looking into all sorts of possibilities, maybe subtle genetic things, maybe even environmental factors.
Like what?
Well, there's even a theory, though it's not documented formally, about potential exposure to human hormone replacement therapy in the dog's environment.
Wow, from humans.
Yeah, it just highlights how many questions are still out there. We've got a lot to learn.
That's fascinating and a bit surprising. Okay, so thinking about these conditions, are certain dogs more prone? What about breeds, age, sex? Do we see patterns?
Oh, definitely. If we're talking about hyperestrogenism, too much estrogen, or hyperandrogenism, too much androgen, there aren't really specific breeds that jump out. But these conditions, they tend to show up in middle-aged to older dogs that are still intact.
Meaning not spayed or neutered.
Exactly. Hyperandrogenism, the androgen excess, that's mostly seen in intact males. Hyperestrogenism, the estrogen one, can pop up in intact females or males.
And what about alopecia X? You mentioned it's more common in certain breeds.
Yes, alopecia X has a much clearer breed signal. We see it way more often in miniature poodles and then those, plush-coated breeds.
Like Pomeranians.
Pomeranians, Chow Chows, Akitas, Samoyeds, Keeshondan, Malamutes, Siberian Huskies, those guys.
Quite a list.
It is. And interestingly, we still don't know exactly how it's inherited, the genetics behind it.
And age for alopecia X.
Typically start showing up in younger adults, maybe 1 to 5 years old, but older dogs can definitely get it too.
And sex. Does intact status matter like with the others?
Nope, that's another difference. Alopecia X doesn't seem to care if the dog is neutered or intact, male or female. It can affect any of them. So yeah, if you have one of those fluffy breeds losing hair symmetrically, alopecia X is high on the list.
Okay, so if you do have one of those breeds, or any dog really, what are the first signs you might notice? What should owners look out for?
Often the very first thing is just a change in the coat's quality. It might start looking kind of dry, maybe a bit faded or bleached out.
Because the old hairs aren't falling out and being replaced.
Precisely. The normal shedding cycle is disrupted. So owners might notice less shedding than usual, paradoxically.
Okay. Anything else?
There's a rather peculiar sign sometimes seen with hyperestrogenism in male dogs. They might suddenly become very attractive to other male dogs.
Really? That would definitely get your attention.
Wouldn't it just?
So those are things an owner might see. What about during a vet exam? What physical signs point towards these conditions?
Well, the main event is the alopecia itself, the hair loss.
Yeah.
And it's typically diffuse, meaning widespread, and bilaterally symmetrical.
See them on both sides.
Right, usually on the trunk, the main body. But interestingly, it often spares the head and the distal limbs, the lower legs, and paws.
Okay. That pattern is less common with the hyperandrogenism one, you said.
Yeah, less common with just androgen excess alone. The remaining fur might feel dry, have that bleached look we mentioned, and then you can get secondary stuff cropping up.
Like skin issues.
Exactly. Things like seborrhea, flaky skin, sometimes greasy, maybe some itching, secondary skin infections, comedones.
Blackheads, basically.
Yeah, little blackheads in the follicles. Ear infections can happen too, and sometimes the skin gets darker, which we call hyperpigmentation. It's variable, though.
Are there any really specific clues for hyperestrogenism or hyperandrogenism during the exam?
Yes, definitely. With hyperestrogenism, you might find enlarged nipples or mammary glands, an enlarged vulva in females, or an enlarged prepuce in males. Sometimes there are distinct dark patches on the skin, macular melanosis, or even a specific kind of skin inflammation on the prepuce in males, linea preputial dermatitis.
Okay.
And for hyperandrogenism, you'd look for enlargement or hyperplasia of the tail gland, that little gland at the base of the tail, and also the perineal glands around the anus.
And critically important, I imagine, is what you don't see.
Absolutely crucial. With these non-inflammatory alopecias, you typically don't see systemic signs. No increased thirst, no increased urination, no major changes in appetite.
Which helps rule out things like Cushing's or diabetes, right?
Exactly. That lack of systemic illness is a really key piece of the puzzle.
Okay, super helpful. So we know what it looks like, who gets it. Let's dig into the why. What are the actual underlying causes for these different types?
All right. For hyperestrogenism in female dogs, the usual culprits are estrogen being overproduced by ovarian cysts, or sometimes, though it's rare, ovarian tumors. Okay. Getting estrogen from an outside source like medication is another possibility. And then there's that interesting, though unproven idea that maybe some dogs are just extra sensitive to normal estrogen levels because they have more receptors in their skin.
Fascinating. And what about the boys? Hyperestrogenism in males.
In male dogs, the most common cause by far is a Sertoli cell tumor in the testicles. Less often, other testicular tumors like seminomas or interstitial cell tumors can do it. And there's a known link, specifically in miniature schnauzers, between hyperestrogenism and a condition called male pseudohermaphrodism.
Gotcha. And hyperandrogenism in males, the excess androgens.
That's usually down to androgen-producing testicular tumors, particularly interstitial cell tumors.
Right. And then back to alopecia X. The hair doesn't cycle, but the why.
That's still the big question mark. We see the result that hair growth cycle stalls out, but despite a lot of looking, no single underlying endocrine problem has been consistently identified. Not yet, anyway.
So it remains this sort of diagnosis of exclusion almost, once other things are ruled out.
In many ways, yes. It's defined by what it isn't as much as what it is.
Okay. Knowing these potential causes, what about risk factors? What makes a dog more likely to develop one of these?
Well, for the hormonal ones, hyperestrogenism and hypoandrogenism, the biggest risk is simply being intact.
Makes sense. Ovaries and testicles are involved.
Exactly. Intact females are at risk for ovarian issues, intact males for testicular ones. Also, cryptorchid males, where one or both testicles haven't descended properly, they have a significantly higher risk of developing testicular tumors.
Right.
And exposure to external estrogen sources, that's a definite risk factor too. But for alopecia X, really the only known risk factor we can point to right now is the breed.
Just being one of those predisposed breeds.
Pretty much.
Okay, let's switch gears to diagnosis. How does a vet figure this out? What's the process?
Right, the diagnostic journey. First and foremost, like we said, you absolutely have to rule out inflammatory causes.
Skin infections, parasites like Demodex or Sarcoptes, ringworm, that kind of stuff.
Exactly. Those usually cause more patchy hair loss, maybe redness, crusts, itching. Different picture than the typical non-inflammatory symmetrical loss.
So rule those out first, then what?
Then you have to consider all the other things that can look similar. The differential diagnosis list can be pretty long.
Uh-oh. Like what else?
Well, there's sebaceous adenitis. That's an inflammatory condition affecting the oil glands, but especially early on, or in certain breeds like Samoyeds and Akitas, it can sometimes mimic non-inflammatory alopecia before the scale and inflammation get really obvious.
Okay.
Then you've got your big endocrine diseases. Hypothyroidism and hyperadrenocorticism, Cushing's disease, they are major rollouts because they cause very similar hair loss patterns.
Right, the symmetrical truncal alopecia.
Precisely. We also think about follicular dysplasia's problems with the hair follicle development itself. Things like color dilution alopecia, where hair loss happens in dilute colored areas, or black hair follicular dysplasia.
Okay, more possibilities.
Yep. Then there are patterned alopecias in certain breeds. Dachshunds, Boston Terriers, Greyhounds, Water Spaniels. These are kind of mysterious breed-specific hair loss patterns.
Oh.
There's seasonal or cyclic flank alopecia, hair loss on the sides, often comes and goes with seasons, more common in boxers, bulldogs, Airedales. Post-clipping alopecia is another one where hair just doesn't grow back well after being shaved, but it usually does eventually, like within a year. And telogen effluvium.
What's that?
That's a sudden, diffuse shedding that happens maybe a month or two after a major stressor, like a serious illness or surgery. The hair goes into the resting phase all at once and then sheds.
Wow. Okay, so definitely a thorough process of elimination. What about basic blood tests? Do they help narrow it down?
You know, usually, routine blood work and urinalysis are surprisingly unremarkable in most non-inflammatory alopecia cases.
So normal results don't rule it out.
Not at all. The one exception might be with significant hyperestrogenism, where sometimes you can see anemia or other signs of bone marrow suppression, but that's not constant.
Are there more specific tests then, beyond the routine stuff?
Yes. We can measure serum sex hormone levels, estrogen, testosterone, others, but it's tricky.
How so?
Well, the levels often come back normal, even when there is an issue, or they fluctuate a lot. So you have to interpret the results really carefully alongside the clinical signs, and usually after ruling out things like thyroid or Cushing's. An elevated estradiol in a male dog might point towards a testicular tumor, for example, but it's not foolproof.
Okay. What about looking inside? Imaging.
Imaging is super helpful. Radiographs, x-rays, and especially ultrasound are great for looking at the ovaries, the testicles, even if they're undescended in the abdomen and the adrenal glands. We can look for cysts, tumors, check lymph nodes for enlargement, or signs of spread if a tumor is suspected. Sometimes laparoscopy, minimally invasive surgery, is needed.
And any specific procedures on the dog itself?
Yes, a couple. Perputial cytology can be useful. You collect cells from the prepuce lining in a male dog. If there's high estrogen, the cells can change and look cornified, similar to a female dog in heat. But the real gold standard, the cornerstone for diagnosis here, it's the skin biopsy.
Taking a small sample of the affected skin.
Exactly.
So what does the pathologist see under the microscope in these cases? What are the telltale signs?
Well, biopsies from non-inflammatory alopecias, whether it's hormone-related or alopecia X, can actually look quite similar to biopsies from endocrine hair loss like thyroid or Cushing's.
Oh, really? So it doesn't always give a definitive answer for the cause?
Not always for the specific type of non-inflammatory alopecia. What you often see are things like a lot of hair follicles stuck in the resting phase telogen. You might see keratin plugs in the follicles, follicular keratosis. The top layer of skin might be thickened hyperkeratosis. Sometimes you see these structures called flame follicles, which indicates abnormal keratin buildup. And often the skin layers themselves, the epidermis and dermis, look thinner than normal.
So if the biopsy looks similar across different types, what's the main value?
The huge E value of the biopsy is ruling out all those other things on the differential list. It's excellent for confirming there's no inflammation, no infection, no parasites, no signs of sebaceous adenitis, no follicular dysplasia, none of that stuff. It confirms you're dealing with a non-inflammatory process affecting the follicle cycle.
Gotcha. It helps confirm the category of the problem, even if not the exact label within that category sometimes.
Precisely. It's a crucial step to narrow things down.
Okay, so let's say the diagnosis is confirmed. It's a non-inflammatory alopecia.
Yeah.
What are the treatment options? Especially for alopecia X, which sounds like the trickiest one.
You're right to focus on alopecia X first because the approach is different. It's absolutely vital that owners understand up front this is primarily a cosmetic condition.
Meaning it doesn't make the dog sick.
Exactly. It doesn't hurt them or affect their lifespan. And because of that, and the fact that there's no guaranteed cure, well, you have to really weigh the pros and cons of treatment.
Because treatments might have risks?
They can. And hair regrowth isn't guaranteed, and even if it happens, it might not last. It can be incredibly frustrating, especially for owners of those beautiful fluffy broods, to see the hair loss and not have a simple fix.
I can only imagine. So managing expectations is key.
Hugely important.
Okay, what about the hormonal ones? Hyperestrogenism, hyperandrogenism.
Yeah.
Are the treatments more straightforward there?
Generally, yes. If the cause is a testicular tumor, castration removing the testicles is the definitive treatment.
And that usually resolves the hair loss.
Yes. Typically, the signs resolve within about 3 to 6 months after surgery. Same goes if the issue is ovarian cysts or tumors in females, or undescended testicles, exploratory surgery to remove the ovaries and uterus, SPAY, or the abnormal testicles is the way to go.
Okay. What about neutering for alopecia X itself? You mentioned that earlier.
Right. If an alopecia X dog is still intact, neutering is often recommended as a first step. In some cases, maybe around 40% or so, they will regrow hair after being neutered.
But not always.
Not always, and it can take up to 3 months to see if it's going to work. But it's often worth trying as it removes potential hormonal influences we might not even be able to measure.
Makes sense. So surgery first where applicable.
Mm-hmm.
What about medications? Are there drugs to try and kickstart hair growth?
There are. First, if there are secondary issues like the flaky skin or blackheads, using topical things like antisporaic shampoos can help manage those symptoms. And obviously, if there's a secondary infection, antibiotics or antimicrobial shampoos are needed.
Right, treat the complications.
Yep. Now, specifically for trying to stimulate regrowth in alopecia X, melatonin is usually the first medical option we reach for after neutering or if the dog is already neutered.
Melatonin, like the sleep supplement.
The very same. The dose varies a bit by size, maybe 3 milligrams twice a day for small dogs, 6 to 12 milligrams twice a day for bigger dogs.
And how well does it work?
Again, it takes time, up to 3 months, to see if it's helping. The success rate is estimated around 40%, maybe a bit higher in some studies, but it's considered quite safe, generally well tolerated.
So, low risk, worth a shot.
That's usually the thinking. We typically stop it once hair regrowth occurs. The main caution is in diabetic dogs, as really high doses could potentially affect insulin sensitivity.
Okay. What if melatonin doesn't work or stops working? Are there other options for alopecia X?
Yes, there are others, but they come with more significant considerations. Medroxyprogesterone acetate, or MPA, is one. It's a synthetic hormone.
How is that used?
It's usually given as an injection under the skin about every 4 rinses for maybe 4 treatments total. Regrowth can take longer to see, up to 6 months, and the success rate is maybe in the 40–50% range.
But there are downsides.
There can be. Potential side effects include things like mammary nodules, changes in the uterus, like cystic endometrial hyperplasia, especially with long-term use, and there are rare reports linking it to diabetes. So it requires careful monitoring.
Okay, definitely more to weigh up there. Any other drugs?
Well, there are drugs like mitotane and trilostane. These are actually medications used to treat Cushing's disease. They can sometimes trigger hair regrowth in alopecia X dogs, possibly by altering adrenal hormone production. But, and this is a big but, they carry the risk of serious side effects, including causing an Addisonian crisis, opposite of Cushing's, and all the other side effects associated with Cushing's treatment.
So not to be used lightly?
Absolutely not. They require very close monitoring, regular blood tests for electrolytes and cortisol levels. It's a significant commitment and risk.
Gotcha. What about growth hormone or testosterone? Weren't those mentioned in the old names?
They were, and they can sometimes stimulate regrowth, but growth hormone has a significant risk of causing diabetes mellitus, and methyltestosterone can cause aggression, liver problems, greasy skin. So because of these serious potential side effects, they are generally not recommended anymore for treating alopecia X.
Okay, so the options get progressively riskier after melatonin and maybe neutering.
That's a fair summary. It's a balance between the cosmetic benefit and potential harm.
So thinking long-term then, what does monitoring look like, and what's the overall prognosis?
For the hormone-driven ones, after surgery, prognosis is generally good for resolution of the hair loss within, say, 3 to 6 months. Monitoring might involve just routine checkups.
Okay.
If a dog is on MPA, regular physical exams and maybe blood work are needed. If they're on mitotane or trilostane, which again is less common for alopecia X, then that intensive electrolyte and cortisol monitoring is crucial.
And prevention. Is there anything owners can do?
Unfortunately, for alopecia X, there's no known prevention other than perhaps avoiding breeding affected dogs, though the inheritance isn't clear. For the hormonal ones, neutering at an appropriate age obviously prevents testicular and ovarian tumor cysts.
Right. What about complications from the alopecia itself?
Generally, none directly from the hair loss. The complications are usually related to the underlying cause, like a tumor potentially spreading, or from the treatments themselves, like the side effects we discussed.
Okay, and the expected course for alopecia X, long term.
It's really variable. Like we said, regrowth might happen with treatment, it might not. If it does, it might be temporary. The hair loss can come back months or even years later, sometimes even while still on treatment.
So it can be a lifelong management situation, potentially.
It can be, and that reinforces the need to remember it's cosmetic. Weighing the treatment risks is paramount. Sometimes, if regrowth happens, the best course might be to stop the treatment and save it as an option if or when the hair loss recurs later on.
That's a really important perspective. Managing expectations and focusing on the dog's quality of life, not just the fur.
Absolutely.
Okay, as we wrap up this deep dive, what are the absolute key takeaways you want listeners to remember about non-inflammatory alopecia in dogs?
I'd say, number one, it's complex, involving the hair cycle itself, not just surface issues. Number two, alopecia X is common in certain breeds but still poorly understood. The why is elusive.
Right.
Number three, diagnosis means ruling out lots of other things, especially inflammatory causes and major endocrine diseases. A biopsy is often key for that. And number four, treatment for alopecia X is about managing a cosmetic issue. Success is variable, permanence isn't guaranteed, and the risks versus benefits of medications need very careful thought.
Excellent summary. And of course, the bottom line is always, if you're worried about your dog's hair loss, talk to your vet. Get that proper diagnosis and a plan tailored to your dog.
Couldn't agree more. And that actually brings up something interesting for you, our listener, to maybe think about. Given how much we don't know, especially about alopecia X, what areas of research do you think look most promising? Where should science focus to really understand and maybe find better, safer ways to help these dogs?
Genetics, the microbiome,
Yeah.
environmental triggers, lots to ponder there. A great question to leave us with. Thank you so much for joining us for this deep dive into non-inflammatory alopecia in dogs.